Welcome to Health Law Talk, presented by Shahardy Sherman Williams. Health law broken down through expert discussion, real client issues, and real-life experiences. Breaking barriers to understanding complex healthcare issues is our job.
And good morning, good afternoon, or good night, whenever you're listening to this. This is another episode of Shahardy Sherman Williams Health Law Talk. Conrad, Meyer, healthcare attorney, here in the studio with my co-host, Rory, Bellina, distinguished, learned, intelligent healthcare counsel. Rory, good morning.
Good morning. How are you?
I'm good. I'm really good, actually. It's a beautiful day. It's a Thursday, so we're kind of rounding out the week. We're in April now in New Orleans and NOLA, 504, MSY, whatever you want to call it. And I think it looks really good, just had the Easter break, so everybody's back in school. Things are good. And of course, when you get back from vacation, work-wise,
that's right,
things start hitting the fan. And, today's episode, you and I are going to talk about something that recently happened to one of my clients, but I think something that we really kind of don't talk about with respect to physician practices, vendor agreements.
Right. Really good, really timely topic. Like you mentioned, I haven't had any issues come up with one lately. In the past, I've definitely seen issues, but it's something that in the healthcare world, you're always getting these vendor agreements to look at. There's some things that we can negotiate, some things that usually we can't. But we're here to talk about some of the issues and pitfalls that we've seen with those agreements.
And interesting you said that when the clients actually give us the vendor agreements. I mean, a lot of times the practice administrators will just take it upon themselves to review it, right? Because they don't want to spend money on attorneys.
Right.
And then they'll just go ahead and sign off on it. And usually what happens, and in my case, when stuff hits the fan, or things start going downhill, is when you or I get the call.
Sure. After it's been signed, after
Right.
it's rolled out, after they've brought in the team from out of state to, launch the product or train their staff, and they're in it for a few months and they've spent time, money, resources, and
Right.
then something goes wrong.
And then you're like, okay, well, here's the problem. Like, there's not a lot of wiggle room at that point to fix it. And so what do you do? So I thought it would be a good idea. We're going to sort of do this as a multi-part series.
Yep.
So today we're going to talk about vendor agreements in general and some of the pitfalls and some of the things that you might want to watch out for. And then in a couple of weeks, we're going to bring in one of my clients who is a physician who was going to talk about, their specific vendor agreement and what happened. So with that being said, vendor agreements, Roy, first off, what's a vendor agreement?
Sure. I mean, there's so many, and we could do a whole episode just on the kind of EHR vendors. But, the vendors are everything from the cleaning company that comes in overnight to the company that takes your equipment and sterilizes it, to the person who manages all your computer systems.
Yes.
It's the whole gamut. It's anything that you're not doing essentially in-house with your staff.
Yes.
You're going to hire a company to do it. In hospitals, healthcare systems, you need, like I said, everything from who's going to clean at night, who's going to pick up your needles, who's going to dispose of your biohazardous waste. All of those things, are going to have some sort of vendor agreement. And some of them are, I don't want to say not as important as others, but some of these vendor agreements we definitely need to take a closer look at compared to others, depending on what they're doing, the costs associated with it, and the risks associated with it as well.
And I agree with that. So, and usually, I mean, like I would say that's like, your vendor agreement for environmental services. I mean, I would say that I don't think that's one that would be flying across my desk. Or yours, I think,
right.
And you're right. So there is going to be some selectiveness in terms of that. The one that I see most often, and the one that seems to be discussed, are really two types. It's the EHR,
yep,
right, and that could be, the EHR that's sort of combined with claims processing, so
right.
Sort of like a billing agreement and an EHR agreement.
Because so many companies have the EHR, but they want you to add on that billing and claims back house as well.
Absolutely. We can name several companies that do that. And then, of course, a straight medical billing type of arrangement.
Sure.
So the straight medical billers who just want to come in and do the claims processing, and then your EHR combined. So, and the reason I think, because those comp models involve percentages.
Correct. That's where the money is. That's where the risk is. That's it's the lifeblood for a lot of these practices. So you have to give it some serious, thought and give it some respect when you're looking at those agreements, because if you choose a company that either is not reputable or they're new to market or they've got something in there that's overlooked by your administrator, it could literally shut down the flow of cash in and really hamper your practice.
And I forgot one. I think any practice management company that would come.
Yep.
Yeah. So I left one out. So practice management companies who will come in and market to a practice
that's again a percentage based
or
on
some revenue cycle
Sure.
management, right? An EHR and then a medical billing. So those are I think the three big ones.
Sure.
That I think would fly across the desk. So the issue is what do you look for and why are those so important? And I alluded to it a moment ago. It's the compensation. In other words, they're taking a percentage of the gross revenue that comes in
Right.
from the medical billing. And usually I find now, like in today's world, that percentage can have a range, anywhere from at least 4.5% to 5%, all the way up to 7-8%, maybe even more.
Sure.
And so, to your point, I think that when a practice sees that, number one, the first thing I think the administrator says is this percentage, is this a normal fair market percentage?
Sure.
Because they've never seen it before. And then the second question is okay, what am I actually signing here? Because to me, I don't care if you're physician practice management, which there's a lot of companies out there that do that. I don't care if you're EHR plus claims or just straight medical billing. The first question is, in my mind, is what are you going to do for my practice?
That's exactly, as you were talking, I was thinking, what are the most important things that I think of when I see these? And it's usually 2 or 3 things. It's what are they going to do for us, and how do we get out of it?
That's exactly right.
Those are the 2 things that I typically look at. And then there's a huge bucket of, I think I'd say, smaller things to be concerned about. But the big things are, what is this vendor going to do for you? It needs to be very clear what they're going to do and not do, including the data part. And then how can we get out of this, and what's it going to cost? How hard is it going to be to shift away? And I think talking about the first part, what are they going to do for you? That's probably where a lot of the details are in the agreement, and that's where you or whichever attorney is involved needs to talk with the practice administrator to make sure everyone's on the same page. Because a lot of times they'll give you like a deck page or like at that front sheet that says, here's what we're going to do and here's the percentages.
And then that deck page will link online to a master agreement.
Correct. Which
right?
we have to go.
And
no one looks at that.
Nobody looks at that. Nobody
Right.
looks at that.
I just had that on my desk the other day. It was like a 1-page agreement, but there's 6 links of all their other agreements after that. It's really important to know, what they're going to do for you. Timelines are very important.
Right.
What's like their uptime or their live time. If we're talking about it like an EHR system or billing and claims, are they going to take responsibility for things that are coded wrong or billed wrong? That's come up a lot because if there's some sort of recoupment or clawback and it was done, if it was a system error, that's come up. I know that's come up with a few years ago. There was a big company, I'm drawing a blank on the name of it, but there was a big issue with meaningful use and how they program their software, and they program their software to get their clients in that higher kind of bucket for higher reimbursements, and they were manipulating the software, and their clients really weren't meeting meaningful use, and the issue came up. Who's responsible for that? Is it the EHR vendor or is it the client? And the government kind of split the baby on the answer, but the EHR vendor got in a ton of trouble on that.
Yeah, and I agree with you there. It's because when you look at a physician office, whether it's EHR, because there are specifics, things I think that are pertinent to each of these types of vendors. Whether it's an EHR, because now I'm thinking about, okay, if it's EHR, I'm thinking like one of the things you just said. What's my uptime, downtime, response time, HIPAA compliant time? How does my BA, business associate agreement, going to look with my vendor, especially if it's a cloud, if it's HIPAA compliant? If do they have downstream requirements? Who's liable, and what kind of company are they? Especially to your point, if there's a meaningful use issue, or God forbid, a breach where OCR is involved,
Sure.
and you get fined, and it's really the BA's fault, do they have the money to pay that? What's the liability for them? And then if it's claims like a medical billing, physician revenue cycle management, or the combination EHR claims, how hard do they work the claims? I mean, it's easy the first 30 to 45, 60 days. You get your first row back. Once you submit the claims, you get paid. But then after that, any, like you said, recoups, refunds or denials, correct? Denials and recoups, how hard is that company going to go work your claims?
Sure. And how hard are they going to work for you versus working for others? Meaning,
True.
Is it a big company that is doing this for everyone? They've got, tons of resources to do it, or is it a new company getting off the ground? Do they have the knowledge and expertise in this field, or are they new to it? Those are all things that everyone needs to definitely do their homework on to make sure that you're comfortable in entering into these types of more important vendor agreements.
And I think, too, if you're an EHR combined claims, right, where you're kind of taking your EHR and the back office of that company generates your claims for you to submit to the payers, in other words, what is the software doing, right, to your point about meaningful use? Think of it from a claim standpoint. How are they coding, like on E&M codes, the level? I mean, is the software automatically issuing a level 3 or 4 or 5, or is that dictated by the physician? And if it's not, because for practice, you want to maximize revenue, of course.
Sure.
But is the software improperly upcoding levels of E&M service where you get caught?
Right.
You get caught.
Yeah.
So I think, and that's where the administrator needs to be very involved in understanding the process when they look at the vendors.
Sure. I think that is probably the most important thing to look at when you're looking at these vendor agreements from revenue cycle, billing, EHR. It's also really important to look at the data and who owns that data and how hard is it to get that data out. I know the government is taking a lot of steps to try to make some sort of universal data set where, you can move data from EHR to EHR vendor. I don't know if that's going to be possible to do.
Across systems, like from Epic to something else.
Correct.
Right.
I don't know if that's going to be possible to do, but that's really important because inevitably, unless you're with a system that works great and you have no problems, you're probably going to need to try a couple. And so getting that out and transitioning that, are they going to help you? I mean, I see a lot of vendor agreements where it says like, if you terminate, you have to, once there's a termination, you have to give us written notice within 10 days that you want our data, and if not, it's erased. And basically, don't talk to us again. So I mean that's pretty unreasonable to do. And then what format is that data and information in with this vendor? Is it something that
you can actually use?
Can you use? Can you bring it into your new system? Are you going to have to pay them to put it in a different format? I mean, those are all things that have come up for me. I know we're focusing on the EHR and billing side, but we definitely want to talk about some other vendor agreements. But that's really important is, you have to think about the breakup and what's going to happen when you need to get your data out.
And now you bring up a good point. When I look at a contract, one of the first things I look at, how do I get out?
Sure.
I mean, that's great. I like what you're offering. It sounds great. How am I going to get out of this? And what are the ramifications of me getting out, right?
Yeah. Is it going to be you can get out at any time, but you have to pay out the remainder? Is there an early termination fee?
And correct. Termination fees, and then of course tech support.
Sure.
Cross compatibility with whatever new.
Because once you give notice that you're done with them, they're not going to bother with you anymore.
They're done, right?
So they have no incentive.
Stick a fork in it. We're done. Out of here
to help you. So they might mail you a flash drive and say, "Here's your data. Best of luck with whoever you go to next."
Right. And if you're a practice, right, and I mean, obviously cash flow is extremely important, you might have a problem where you're stuck for 30, 60, 90, God forbid, 120 days with no operational cash flow.
Sure. Or is it something where it's so bad, but you're too scared to leave this vendor?
Because they got you.
Because they've got you, and you know that it's going to shut down operations for too long.
And one of the things that vendors do is to strategically position themselves, some of them to do just that.
Sure.
So, for example, let's just say a more egregious example: a vendor, an EHR vendor with a billing contract that has a rate of, like, say, 5%. Okay, and then they have a termination without cause provision for 90 days or even 60. They say 60, okay? And the tech support is very vague in terms of downtime or uptime, and the data ownership, like you said, isn't really clear. It's not clear, right? So that all that vendor has to do to strong arm that practice is come in and say, hey, look, we're not happy with the 5% billing rate, okay? We're going to want 6 or 7%. You're talking about gross revenue too, okay?
Sure.
Gross on top of everything, right? 6 or 7%. Not to mention all the tech support fees, training fees, up there, all the other fees that get associated because they loop in there, right? And sometimes through, like you said, through the deck sheet, through the link to other agreements that you don't even read.
Right.
So they're going to strong arm you if you don't agree to the 6.5, whatever, 7%. We're just going to terminate the contract without cause, and in 60 days we're out of here.
So they're forcing you.
They're forcing you. They're forcing you to eat the vegetables.
Yeah.
Either you take it's my way or the highway, and
if you don't pay it, go find someone else who's probably going to charge close to it,
right?
Because they're picking that number because their competitors are doing it,
correct,
most likely. But you're going to have so many more costs associated with switching.
So when you look at those kind of agreements, whether it's revenue cycle, EHR, medical billing. I mean, there's so much that goes into, in addition to just the fee, you have to think strategically of how can these people get me, right? And what do I need to do to protect the practice and cover everything? The extra hidden fees that you might not be aware of,
right,
the cross-compatibility of data that you might not be aware about, what kind of access to data. Because a lot of times, if you have your own people that can then go look at the claims, right? They need access to data. And if the vendor says, well, like you just said, hey, we're out of here in 60 days, we're done, and they cut off all claims data, you might be leaving thousands of dollars on the table because your people don't have access.
Right. Yeah, I think that it's that is, like we said, what are they going to do for you? And then the termination, those are the big things to look at. After that, so other things I think that are always important to look at is, and a lot of times these vendors are going to put in there the governing law jurisdiction in the state where they're founded or where their attorney is.
Good point.
I always try to get that in the state where we're actually operating. A lot of times that's unsuccessful just because they're like, no, we have one set of attorneys, or we're incorporated in New York, so we're doing everything in New York. That becomes up a sometimes more of a business decision on, are you okay with that? Let's God forbid nothing happens, but if it does, we're going to have to get an out-of-state attorney to deal with that. I think that's something important to look at. And then
to that point, what do you do then? So let's just say, like to your example, right? It's a New York company. They don't want to do anything. New York law, New York jurisdiction. I mean, do you then try to say, okay, fine. Well, then I want an arbitration clause or a mediation clause that allows me to mediate or arbitrate, right, in my location.
Yeah, I think that's typically the fair compromise. Is getting that in there, just so you don't have to go. If you think that there's a breach of the contract, you don't have to hire New York counsel if you're here in Louisiana and fight that there. I think that's a fair compromise.
But how often do you get an agreement from a client before you even get to that point? I mean, that's the thing.
Yeah.
How many doctors sit down and right?
A lot of times it's too late.
It's too late.
It's too late, and you're stuck with it.
And the sad thing is, and this is one thing, I think this is why this podcast is really important, especially for providers in practices, is because penny wise, pound foolish.
Sure.
Penny wise, pound foolish.
Sure.
And look, hey, doctors are very smart. I mean, they wouldn't do what they do if they weren't very smart.
Right.
However, you don't know what you don't know.
Right.
And so I think, and it's always been my position to have a very trusted attorney, right, healthcare attorney, who literally can walk you through your practice, that can be there for when you need.
Sure.
And utilize that person. That doesn't mean you have to pay them a general counsel fee.
Right.
But I think when you're trying to avoid the minds or the bodies where the bodies are buried, it's very effective.
Yeah, I think that to kind of self-advocate for ourselves or for someone in this field.
Yeah, this wasn't a commercial for us.
But we've all seen the vendor agreements
exactly.
for all the different industries. So I know when I get a vendor agreement for a staffing agency, I know I need to make sure that there's language in there that if we don't like somebody for a reason, they get removed immediately.
Right, exactly.
And they need to be substituted out. I know that there needs to be a pool of people. I know that they need to meet like our background check policies. In the EHR world, I know that we need to really focus on what they're going to do. Is there going to be a cost to get this data out? Are they going to help us transition it? Like there's little niche
tech support,
things.
training, data, all that stuff.
Yeah,
right,
there's really niche things. I know if we're doing like Sterils and Sharps, those type of vendor agreements, it needs to be ensured that they've got all the certifications, they've got all the insurances. If they get fined, they're not going to pass down us for improperly disposing of things like that. I know if it's an agreement with your IT company or the people that do all your docu-shreds or the people that come and dispose of stuff, that got a really good BA and they've got good insurance, because if there's some sort of breach, we don't want those fines from OCR to come down to us if they don't shred something and it flies out the truck and someone finds it.
And that's not to say that a practice administrator doesn't have the knowledge, training, and experience to do that. But I think when you're working on the same team and you have a healthcare attorney who is, like you said, like you, understands all of these ramifications of the niche vendor agreements, that a practice administrator should utilize all of the tools they have in their tool chest. And so, I think it's wise.
Sure.
But sometimes people don't want to do that. So the problem is, like you said, though, what do you do when you get that oops call, right? And it's kind of like, well, wait a minute, there's really nothing I can do. You sign the agreement. It is what it is.
And we've got a company that's out of state with New York law, so now we're calling attorneys in New York saying, hey, we want out, and they say, okay, we'll pay out the remainder of your contract. And
you got 3 years left. Pay it all out.
Yeah, and so those are the calls that I hate to get, because your client gets stuck with it and they end up riding it out, being unhappy, or their staff is unhappy with the software or whatever it may be. If you're doing your vendor agreements for devices or implants or something like that, looking at that exclusivity, because if you bring in another group of docs and they don't like device company A's stuff and they want device company B, but that you just signed a 5-year deal to order all these implants from device company A,
you're stuck.
Well, what are you going to do?
Right.
And you agree to purchase a certain amount, and if you don't purchase a certain amount, they're just going to bill you for the difference. That's really big in like the ortho, the plastics world, spine, because a lot of these doctors, they get very loyal to certain brands and certain reps. And when they move over, they say, well, I don't want to use A, I want to use B. And so if you've already got a contract with A, what are you going to do? How can we make this work to keep the doctor happy but also not breach an agreement?
Well, and that's a good point. And I find the whole business very interesting, because you've got reps pushing devices.
That's definitely another
podcast, conversation, right? But you got these reps who their livelihood depends on selling quantity.
Right.
Then you've got cutters, like their practices, who rely on cutting for their livelihood, right?
Right.
And then, you got vendors who look at, okay, I need to make my cut too.
Sure.
So your revenue needs to be on the line. Otherwise, because they're doing they're doing the data management. They're seeing how much claims come in. So, if year one, that group has, let's say, $10 million of claims, and they set their benchmark level at 5%. We're going to take 5% of the $10 million. Okay, that's $500,000.
Right.
That in their mind, that's the fee. In year two, let's say those claims drop down to $8 million. Well, then now they lost $100,000.
Right.
Well, they're going to come back and say, well, hey, look, our billing fee was 5%, and we were guaranteed X amount of claims. You drop that. Well, either you agree to an amended contract at 5.4% or whatever, 5.2 or 5.5, or we're going to terminate you without cause.
Yep. And then you have to start this whole process over.
Correct.
And move over, and you've got to change all your
either way you take it, right? Because we're going to because you have to come back to us anyway, right?
Right.
Either you take what we're offering now, or we're going to terminate, and then I don't care if we lose you or not.
And that you're going to have to pick a new company, onboarding, change all your systems,
and then you're at 120 days.
Right. right? So
that's a big deal.
I think that's going to be the topic with our next guest.
It will be. It will be.
Some more facts and circumstances on those, because these vendor agreements, look, everyone knows that the healthcare is, I think it's the second or first in GDP in the United States. It's definitely
we're 1/5 at least.
Yeah, I mean it is where the money is right now, and it's only going to continue to grow as the population ages. So all of these companies see that. So everyone wants, these Amazons, all the tech companies, everyone wants to get into healthcare. They see that that's where the money is, and the government pays for it. So that's also another big incentive. There's not a whole lot of things that the government reimburses for, but healthcare happens to be one of them. So there's a lot of people that want to get into this air quotes space. And so you have to be really careful with who you choose to help you out, because if you choose the wrong person, it can be hard to get out of, or it can be very costly.
So let me just say this. I know a lot of times we ask our listeners to send emails or something like that, and give us comments or suggestions, and we got a couple. I would ask, our providers who listen to this and who really, if you have an experience with a vendor and you've had issues dealing with some of the things that we discussed today, that you reach out to us. I would love to have you on a subsequent show so that you can educate other physicians, other providers. It doesn't have to be just physicians. It can be facilities. It could be ASCs. It could be anything.
Yeah, it could be a horrible story about the cleaning company that you had and how you had
absolutely.
to get them, or whoever it is.
Yeah, if you want to come on the show and you want to talk about experience so that you can educate others and help other facility managers, hospitals, practices, whatever, not fall into the same bear trap that you did, or you just want to talk about it, we'd love to have you. Love to have you.
Absolutely.
I think, Rory, that's going to wrap it. Any final thoughts on vendor agreements for the providers?
No, just, work with your practice administrator, work with your counsel, because they've probably seen, where the holes are, and they can help you avoid them.
Excellent. Food for thought, words for advice from the excellent, intelligent Rory Bellina. Anyway, we're going to wrap that up, folks. We really appreciate your time letting us come in and share our thoughts with you regarding vendor agreements. We'll be having some special guests for us coming up soon. And until that time, everyone stay safe, enjoy. Thank you for listening to Health Law Talk.
Thanks for listening to this episode of Health Law Talk, presented by Shahardy Sherman Williams. Please be sure to subscribe to our channel, make sure to give us that 5-star rating, and share with your friends. Shahardy Sherman Williams is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does this podcast establish an attorney-client relationship. Reference to any specific product or entity does not count as an endorsement or recommendation by Shahardy Sherman Williams. The views expressed by guests on the show are their own, and their appearance does not imply an endorsement of them or their entity that they represent. Remember, please consult an attorney for your specific legal issues.